amazing panel with amazing guests with incredibly extensive backgrounds in service. But the focus of today's talk for this panel specifically is on collaborative care. We know that in our community, we're serving not just and we're often serving in many different capacities, whether it's imams alongside, or imams and chaplains, or religious authority and religious figures alongside clinicians and therapists and people in different aspects. And in this, we're often trying to negotiate and navigate how that relationship works together to serve the whole being of a human being. And so I'm honored to be the discussant, or in my way of understanding, the moderator for this panel. And inshallah, I look forward to hearing from everyone. Up first, because we're a little bit behind, I'm just going to go ahead and take the liberty of adding 20 minutes to everyone's discussion. I hope that's okay. If not, the authorities will stop me, inshallah. But our first discussion for today is going to be by a dear beloved friend, Hafiz Farhad Syed, on a survey of Islamic clergy and community leaders regarding mental health and first responder training. Now, Hafiz Farhad is a Hafiz Quran. He is, mashallah, the future of Islamic and secular education. He's a student at Dar al-Qasim, studying under numerous scholars, but under the renowned Sheikh Amin Khalil. He's also a Psy.D candidate at the Chicago School of Professional Psychology and an intern simultaneously at the Khalil Center in Chicago, Illinois. So without further ado, Farhad, barakallah feek.
Jazakumullah khair for that wonderful introduction. Definitely not necessary. Let me just take a moment to get this up and running. Bismillah. Okay, can you all see this now? Okay, alhamdulillah. Let me just put this in. All right, we're still good, right? Everyone can see? Alhamdulillah. All right. So, begin Bismillah walhamdulillah wassalatu wassalamu ala rasulillah wa ala alihi wa ashabihi ajma'in. Jazakumullah khair for everyone attending today's seminar. I'm a little embarrassed to be the first speaker in this wonderful lineup, so I will try to keep mine short so that we can have our more esteemed guests speak, inshallah, and carry on the seminar. I'd like to quickly give you a synopsis of what this presentation will be. We did a study at the Khalil Center looking at a particular training called the First Responder Training, which looked to educate and train imams, clergy, scholars, and other community leaders with mental health training. And essentially what we wanted to do is understand the impacts of what this training had on the community at large. So we did a brief program evaluation survey looking at what areas of growth we see in the community, and tried to create questions to sort of track all of that information. So let me begin, inshallah. It's not working. All right. So as I mentioned, the First Responder Training, which is in my little fun acronym called the FRT, it is basically a faith-based training tailored to improving clergy members' understanding and responding to mental health concerns, with the focus on Muslim populations. So I think many of us have heard of mental health first aid, similar 8 to 10 hour trainings that are available to individuals, to organizations, that basically provide some psychoeducation as to what mental health is, what the impacts mental health have on a person, especially if it's a disorder. And basically these trainings are pretty widespread. However, we found that there aren't too many that are addressing this specific niche of our Muslim community. As I said in the third point, that this is the largest documented training that's specifically designed for imams and community leaders, that integrates Islamic principles and values into the approach of addressing mental health issues. There's no other training to date, at least that we have found, that is specifically working to help imams and clergy, those who serve the communities on the front line. There's no other training that provides this type of information and the experiential. There are some breakout sessions which allow imams to try their hand at, working through a crisis situation or working through a therapy session with the guidance of a mental health professional. So this is very unique and is, at least to our knowledge, has not been yet replicated. There has been to date 8 FRT trainings between the years 2016, 2018 throughout North America. I'll go into where those locations are later on in the presentation, inshallah. So as I mentioned, the target trainees for this training were imams and community leaders, hence the name. And our intention was to equip these clergy members with the tools and knowledge base to identify and respond to congregants in their community, in our masajid, in our greater community centers, to see the different mental health related issues that come up, whether it be anxiety or depression, or even some religiously induced mental health disorder, perhaps like OCD or something like bipolar. So the training is looking to encourage that and also encourage a collaborative relationship. This is probably the main part, and I hope I'll be highlighting this throughout the session. The main part is to encourage a collaborative relationship between the religious leaders and Muslim mental health professionals, so that we realize that those are very different fields, two very different streams in our community, and they often do not have any point of contact. But through this training and through the coming together of both different fields of study, we hope to encourage more of a discourse and dialogue in these cases. For the FRT, we usually have 2 trainers. Number 1 is a Muslim mental health licensed professional who is usually a doctoral level clinician with a background in Islamic studies. So this is not someone who maybe took one class and, oh, mashallah, I've completed the 40 hadith of Imam Nawawi. And mashallah, that's great. But what we sort of hold to a higher standard are those who have completed their Fard Ain in at least like a year-long study in a seminary. Or someone who has spent a long time in a Muslim land, who has been able to accumulate a lot of these Islamic sciences. So that's what we mean when we say a black background in Islamic studies. So it's not simply someone who is a Muslim mental health professional, but someone who has internalized some of the Islamic sciences as well as the Western psychological sciences. The second point is a person who is a clergy member, an imam or a scholar or an alim with a behavioral science background. I know he won't appreciate me saying this, but mashallah, the speaker right after me, Mawlana Bilal, who I think should have gone first, is someone who's done this FRT training. He himself is an alim, a sheikh, who has extensive research and studies in the Islamic sciences, but mashallah also has a master's in the behavioral sciences, who gives him that nuance to be able to understand issues of mental health and see a greater picture. And this is something that we hope is indicative of the type of training we're trying to have, not simply one-sided. Alhamdulillah. So I wanted to do a quick snapshot for those who don't believe that maybe training imams is useful. So here's some research. This is not my original research, but from a literature review, but it still, I think, paints the picture very nicely. We see after 9/11, there's been an exponential increase in people, Muslims specifically, seeking out imams to address the concerns that they're having, mental health related concerns. And that has been just constantly a positive trajectory from 9/11. And we see from this study as well that most of these imams are counseling multiple times a week, right? It's not just once when one musalli, one congregant has an issue and that's it. But some of these are recurrent issues, and imams are being forced to serve their community in that fashion without having the proper training. And that goes into the third point, that most of these imams, their alimiya programs, their scholarly discourses and lectures that they go to, they don't focus on mental health. Rightfully so, they're specialists in that field, but this is maybe where there's more of an interdisciplinary approach, where we have both Muslim mental health professionals and Muslim scholars that can come together and work off of each other, bring the strengths of the mental health professional and bring in the strengths of the Islamic scholars to bring a more complete and holistic way of addressing mental health concerns. In this last point, I think this is something everyone knows. Our imams are overworked. Our scholars are overworked. They have, very, very little time, and they're doing so many things, mashallah, like leading prayers, delivering sermons, nikahs, and providing spiritual guidance. And they really are the glue that keeps our communities together. So this is why we find them to be in this very niche area of the community, that they have so much clout, they have so much exposure to the community, and can really provide a lot of support to their congregations and the Muslim community at large. So I wanted to briefly go over the objectives of the FRT. These are very simple. These are what you find in the FRT handbook. But number one is to gain familiarity with mental health conditions. This, I think, it should come to no surprise. Many of us are looking to understand, where does anxiety come from? Where does depression come from? What is schizophrenia? What is bipolar? And these are like disorders that we hear about and we'll see on TV or we'll see in the community, but we don't really know what they are. And the FRT seeks to help elucidate what are those issues exactly, so that when an imam who sees someone that's anxious, or a person comes into his office and says, you know, I'm feeling delusional, what does the imam do in that case? Does he just simply say that, oh, go to Araqi, go get some ruqya, because it's clear that you're not there? Is that usually that's not supposed to be the case. We should be increasing our perspective and our ability to discern what problems our musallis are facing. So that's number one. Number two, to understand the system of mental health referral. This is especially important because Muslim mental health professionals are usually away from the masjid. We don't see too many masajid that are housing mental health professionals. So where do imams and mental health professionals connect? They connect through these relationships that we form, but those are intentional relationships. We don't find that it's going to happen naturally unless we have these separate trainings where we have imams and mental health professionals come together. So this is a second point, which the FRT, I think, does a very good job of. Number three is how to empathetically listen and understand the crisis. As I mentioned, I've had personal interaction with imams who had clients that were suicidal. And the first thing that came to the imam said was what? That, brother, suicide is haram in Islam, and this is not something that is permissible. You should not be thinking about suicide. And I'm sure all of us as mental health professionals have a reaction. That is not normal, right? That is not the correct response in that case. If a person is actively suicidal, he does not need to hear the fiqh of suicide or the fiqh of living or whatever. So this is very clear and something that's touched upon heavily in the FRT. The fourth point is the relational processes that influence the pastoral relationship. Pastoral counseling is still slightly different from intensive psychotherapy. And this is something we want to highlight to our imams and our clergy, that mashallah, you're having a great deal of an impact on your musallis, but there is still a barrier and a boundary around what you can do. That moves into the last point as well, but that's something that we really try to hone in on, that there is limits to pastoral counseling, and that we need to recognize when it's important to bring in a mental health professional. And this last point, appreciating the need to work with and collaborate with mental health professionals, has been sort of already covered, but this is just to sort of focus in on that relationship and building that amongst our imams and our mental health professionals. Alhamdulillah. So I know this is a brief method section. It's not very that expansive. So I just wanted to quickly mention it, so in case anyone was wondering. We basically devised a 21 item cross-sectional self-report program evaluation survey and delivered this to all the trainees of our FRT. And that was, I'll get into the numbers later, but that was about 500 people. And alhamdulillah, from 2016 to 2018, we had about 8 sessions, and all of these people had responded. Some of them didn't, but we had a good amount of response, at least for the time being. The survey was made through Google Forms, and as I mentioned, just sent via email. All the questions, they were either of Likert scale, 1, 2, 3, 4, 5, or they were open-ended questions. We did make the Likert scale questions required, so at least we got some meaningful data. If the participants did not want to, they didn't want to finish the entire quiz, we had to get them in there and try to make sure that they completed as much as they could. And alhamdulillah, we had a significant amount, although I would guess the number is probably a little depressing. We had about 500, and we had 25% that responded. Again, 128 responses on this training is pretty reasonable. And alhamdulillah, that's a great thing. And as I said, imams, scholars, counselors, teachers, these are all people who are present. Again, it was intended for imams and community leaders, but all of these people are people who are on the front lines, administering mental health care in a way that most mental health professionals are not providing care. So this is, alhamdulillah, the FRT being beneficial. I will go into the results now. Alhamdulillah, we've seen that the FRT has multiple positive results. The first one is, do people have a better understanding of mental health illness, right? And most of them said yes. 72% said yes. And we included somewhat just to make sure that if someone didn't feel 100%, but we're looking at a positive pie chart. People are feeling that this has been a positive impact on their understanding of mental illness. And this is another important one. On the right-hand side, you see, would you have attended this mental health training if it was not informed by Islamic values? We see that 79% said maybe or no. So that's 79% of people that would probably either A, not come at all, or were hesitant to get any type of mental health training if it was not informed by Islamic values. That in itself, if you would just look at our communities and imagine how many people that is actually. You know, it could be like thousands of people that are just not interested in getting any type of training. So this is an important result. Nearly 60% of respondents report their beliefs and perception of mental health to have changed as a result of this training. Again, alhamdulillah, some benefit of the FRT. And all of them have felt that through the FRT, they better understood mental illness and its solutions. The solutions part is very key here, that they know now they have the tools to address the issues that are being faced. And this last point over here, that most individuals found the Islamic approach to mental health, the current research that's being used in the FRT, and the presenters, as well as the need. The need is probably one of the most important points, that people understand that this is something that's not currently happening, and we need to have this more. All of these points are appealing aspects of the training. How many individuals do you serve in your community? We did a slight calculation, it's probably not 100% correct, but we have a general number that looking at all the people who are serving their community, we came up with a number of about 12,000 individuals were directly impacted or directly going to be serviced by this FRT training, alhamdulillah. And almost 96% of these trainees would recommend this training to others, alhamdulillah, leaving a positive review of the FRT. Approximately 50% of FRT participants reported that they counsel and provide therapy to others on a weekly basis. This is our statistics. This is not the literature review that I mentioned before. So we have a lot of imams and counselors who are providing counseling and therapy on a weekly basis, and about 20% provide counseling services daily. Just want to quickly mention our limitations. There was a lag in the administration of this survey. It wasn't done exactly when the training was done. So this, inshallah, is something we want to address in future studies. And also, we didn't focus on demographic data. That made it easy for us to provide anonymous surveys, so no one's identifying information is kept. But we feel like after reflecting on a lot of this data, if we understood where people are coming from, the SES, the race, the ethnicity, we would have much more meaningful data, inshallah. And I know I have like 1 minute left. I just want to quickly go over the concluding remarks that, alhamdulillah, I hope just by this presentation, we understand that there is a very high importance to understand imams and mental health professionals, that they need to come together. This is what the FRT stands for, right? This is not for the mental health professionals to become scholars, and this is not for imams to become mental health professionals. We have to work within our wheelhouses, and this is what we're trying to, the dialogue and the collaborative relationship, hence our collaborative care session, trying to bring these two streams of people together. And I would like to just mention that the Khalil Center did blossom in areas where there was high collaboration with imams. So that's in Chicago, in the Bay Area, in Toronto. All of these areas, multiple imams and scholars came up to us, and they wanted a Khalil Center so that they could refer their clients to. So we're seeing that an increasing trend of imams and clergy that are trusting places like Khalil Center to provide mental health services. So alhamdulillah, I hope I'm still on time. Just wanted to end there. Barakallahu feek. Jazakumullah khair for listening. I pray this was of benefit. Assalamu alaikum wa rahmatullahi wa barakatuh.
Alaikum salam wa rahmatullahi wa barakatuh. Jazakallah khair, Hafiz. Inshallah, next we're going to just jump right into it. Don't forget that you can please send questions to me directly in the chat box, bidnillah, and I will sort of try to aggregate them and direct them to the appropriate people, bidnillah, in time for Q&A. But next, inshallah, we have Mawlana Bilal Ansari, who's going to be speaking on a collaborative care model for clergy and mental health care practitioners. And just before Mawlana Bilal jumps in, we want to remember that Mawlana Bilal is an erudite and academically published scholar of the sacred sciences. His undergraduate degree was in applied behavioral sciences, focusing on adult learning theory. Currently, he serves as a lecturer and academic advisor at Dar al-Qasim in Chicagoland. He also serves as religious consultant and president and board of directors at the Khalil Center in Chicago. فليتفضل. بارك الله فيكم.
بارك الله فيكم. جزاكم الله خيرا. Dr. Hafiz Farhad and Sheikh Abdul Malik. الحمد لله رب العالمين والصلاة والسلام على سيد الأنبياء وأشرف المرسلين وبعد. Just to jump right into the topic of conversation and the presentation, first and foremost, I think it's important to recognize the sort of challenge that exists when we talk about collaboration, integration, interdisciplinary projects. The development of a new field of integrated Islamic